Hello everyone, good morning and welcome to our channel. In last lecture we have seen about the different route of administration. So we are the injection. We have already learned about what are the four type of injection. First is intravenous injection, intradermal injection, intramuscular and subcutaneous injection. So now we'll start with the next type of injection. The fifth type of injection is intra-articular injection. As you can see in this picture, there are some arteries, or the red dot line, it is showing a artery. So artery, you know about what are arteries and what are veins. So the drug which are directly injected into our artery are called as intra-arterial injection. Okay, so because it is intra-arterial artery, the normal function of artery is it provide a oxygenated blood to each and every part of our body. So because of this, as it is carrying oxygenated blood and it is providing to each and every part of our body, this lead to, whenever we are injecting a drug in artery, it lead to localization of drug effect in a particular organ or tissue. Okay, so this type of drug, that is intra-articular drug, are preferred in some conditions only. Whenever there is a anti-cancerous agents are there, or some antibiotics are there, so for administration of these drug we are going for intra-arterial injection. Otherwise we are not going for intra-arterial. Why? Because it is given below. Plus some diagnostic agent for diagnostic purpose are given by this route. Okay, means by intra-arterial route. So there are some advantages and disadvantages. Advantages, as I told you, because it is reaching to each and every part of your body and it is carrying oxygenated blood, and that's why high concentration of drug can be reached to specific organ, because it is your arterial blood, it is carrying blood to each and every part of your body, and that's why high concentration of drug can be reached to specific organ only. It is most important advantage of intraarticular injection. The second is disadvantage. Disadvantage is because of various risks which are associated with this intra-articular injection, and that's why it is rarely used, because the effects are directly produced into your body. High concentration of blood is immediately produced into your body, and that's why it is producing a number of side effects, and it is risky for administration, and that's why whenever it is required, then and then only these intra-articular injections are administered in our body, and they are administered by expert only. Okay, then because it is arterial, so aseptic conditions are needed in this intra-articular injection. It is all about intra-articular injection. So we'll go for the sixth type of injection, and the sixth type of injection is, sorry, yeah, intrathecal injection. So what is intrathecal injection? So the drug which are injected directly into subarachnoid space are called as intrathecal injection. You know about what is the subarachnoid space? The space which is present in between meninges of your brain. It is called as subarachnoid space, or in between your brain, layers of brain. Okay, in this diagram you can say which one is the subarachnoid space. Okay, so in this subarachnoid space there is a presence of CSF, that is cerebrospinal fluid. So you are directly giving drug in that cerebrospinal fluid or subarachnoid space which is there into our brain. For example, it is used when local and rapid effect of drug like spinal anesthesia, antibiotics are needed to treat meningitis. Meningitis, it is nothing but the disease or inflammation of your meninges. I think you are aware of what are meninges. Okay, so whenever there is a disease or infection to your meninges, then you are going for this type of intrathecal injection. Then there are some advantages and disadvantages of this intrathecal injection. First of all, advantages are drug passes directly into subarachnoid space. Why? Because you are directly injecting drug. In diagram you can see that it is injected into subarachnoid space. Then next is drug act directly on meningitis and your spinal cord. Why spinal cord? Because it is connected with your brain, right? Your brain and spinal cord, they are attached with each other. And last is significant CSF level is achieved, that is cerebrospinal fluid level can be achieved because of this intrathecal injection. Next is the disadvantages. So disadvantage is because the injection, it is directly given into your meninges or into your brain, and that's why strict aseptic condition are required for injection of intrathecal. Next is expertise. High level of expertise are required for this type of injection. Then next is it is quite painful and it is one of a risky procedure. So it is all about this intrathecal injection. The next type of injection are intraperitoneal injection. So intraperitoneal, peritoneal, it is one of a layer which is present into your body, that is in it is layer surrounding your stomach, your cardiac layer, then lungs. Okay, so there is one layer which is, or there is one protecting layer which is present into your peritoneal cavity or into your stomach, which is called as peritoneal space. Okay, so we have to give injection into that peritoneal layer. Okay, and that's why it is called as intraperitoneal layer. So the drug is injected directly into intraperitoneal or into the peritoneal space of your body. So it is normally used for dialysis fluid, administration of dialysis fluid for peritoneal dialysis. Whenever there is a peritoneal dialysis is needed, in this case you are going for this intraperitoneal injection, and it is most of the time used whenever there is a poisoning or renal failure. Poisoning or renal failure, in that case you can go for this intraperitoneal injections. Or these intraperitoneal injections can be also used for providing glucose or saline solution to infants or bachu. So there are some advantages because peritoneal layer, it is this one is the one of a large layer which is present into your stomach, and that's why rapid absorption is there because of large surface. Okay, rapid absorption is possible because there is a large surface area is available for that drug. Disadvantage is strict aseptic techniques are needed, then it is quite painful, then there is a chance of adhesion or infection into your peritoneal cavity, and mainly this route mainly provides systemic effect. Okay, this it is not provide any kind of local effect, it is providing a systemic effect. So it is about this intraperitoneal injection because it is administered into peritoneal cavity, it is called as intraperitoneal injection. Then next is intramedullary injection. So medullary, that is the injections which are administered into bone marrow. The bone marrow, it is present into your tibia or sternal bone. So the drug which are injected into your bone marrow are called as intramedullary injection. Okay, so they are normally employed, these intramedullary injections are employed in infant or restless patient whenever there is a inavailability of veins are whenever there is a inavailability of veins, or the veins are either blocked or circulatory collapse is there, then and then only you are going for this intramedullary injection. Plus it is also used for bone marrow transplantation. You know about bone marrow transplantation, blood transplantation. So at that time these intramedullary injections are given. So in this diagram I have shown what is intramedullary injection. That is injection, it is given into your sternum part and or tibia part, and it is going into your bone marrow. In infant, this intramedullary injection, in adult, the injection, it is take place into sternum and tibia, but in infant or children, this injections, it is takes place into tibia. Okay, so in adult, the injection is inserted into sternum, and in children or infant, the injection it is given in tibia. Okay, and precautions are same as your intravenous injection. The advantage are it has a rapid onset of action because it is going into your bone marrow, so it has a rapid onset of action. Disadvantage is first is skill is needed. It is risky and painful. Next is quite aseptic techniques are needed because it is bone marrow, so aseptic techniques are needed. Next is root is contraindicate in patient with history of bacteremia. Bacteremia is nothing but presence of bacteria into your bloodstream. It is called as bacteremia. And osteomyelitis is inflammation of bone. It is called as osteomyelitis. So whenever these two conditions are there, these type of injections are contraindicated. The next injection is intra-articular injection. Intra-articular means articulation means joint. So injection which is directly injected into the joint, it is called as intra-articular injection. For example, hydrocortisone and gold chloride injection, which is used for rheumatoid arthritis, are takes place in this intra-articular way. Plus some diagnostic agents are also given by this type route of administration. Okay, then intra-articular means articulation. The pictures itself shows that it is the injection, it is inserted in between your joint or into your joints. Both diagrams are indicating the same effect. Advantages are high concentration of drug, it is provided into localized area. Localized area means wherever the effect is needed, at that area high concentration of drug is reaching. Disadvantage is strict aseptic techniques are needed. Then next is it is quite a painful procedure. Next, this route provide a local effect. It is one of our disadvantage. Then repeated injection into joint space may further damage your joints, and that's why everyone says that don't take injections into your joints because it is producing a damage to your joint. Okay, the next type of okay, so these are type of injections. After that, the second part in parenteral route of administration is inhalation. So inhalation, it is one of a route by which drugs are takes place into your body. So drug is normally inspired into our body by nose or mouth. Either we can use aerosol system, or they can also administered in the form of vapor. Then certain drugs can be sprayed as a minute droplet which get deposited onto your mucous membrane, which is present into your nasal system or respiratory system, and it produces a local effect. For example, adrenaline spray. Plus some drugs are administered as a gases or in the form of smoke. For example, carbon dioxide, volatile gases, some local anesthetic. Plus oxygen and general anesthetic, these are the drugs which are also used by inhalation for its systemic effect. For example, salbutamol, it is used for treatment of bronchial asthma. So in this figure you can see the formulation. It is used by aerosol system or by nebulizer or by any apparatus which is providing direct effect, or the drug is directly going into your lungs and it is producing some effect into your body. That is by passing through lung, it is going into your alveoli, and from alveoli it is exchanged into your blood circulation, and that's why it is producing effect into your body. Next are, so these are some advantages. So it provide a rapid absorption. Then because there is a rapid absorption, it provide a rapid local and systemic effect of your drug, and this is possible because of a large surface area of alveoli which is available for the rapid absorption of drug. Then self medication is possible, yes. Then hepatic first pass metabolism is avoided by because drug is not going into your liver. Then systemic concentration of volatile drug is effectively controlled. Okay, so these are advantages, and there are some disadvantages as drug, because this drug it is directly going into your left side of your heart. Why? From your lung. And that's why sometimes it is dangerous and it is producing cardiac toxicity. Then